The most stressful thing as a doctor is to go to work and worry that you might not be able to give the best care to your patients, to have to look at yourself in the mirror, to look at a patient in the eye and say, I didn't do my best for you and I'm sorry. And the contract is only going to make that worse. It's only going to make that happen more often.
If you got on a plane and found out that your pilot was flying without a co-pilot, and this for multiple days, he was jet lagged, he was tired, would you want to fly on that plane? And if the answer's no, which I'm sure it is, then why are we willing to do it with our health as well?
It won't be long till I'm gonna need somebody to lean on.
What we feel is that if this contract is opposed, there'll be a worse service going forward in the UK for people's healthcare, and this will affect people's lives. It's not a joke. It's healthcare, and people will die as a result of this contract.
I've come here to show my presence and show my support for the movement against imposition of our contract.
We still feel that although good progress was made in the negotiations, this contract remains unfair on doctors and on patients, and also unsafe as well.
We've come particularly here to the Department of Health so that the people involved can see our faces and talk to us if they're interested in about what's brought us out here today.
So I think there's lots of things that are good from in the contract. So where we were in the autumn to where we are now, we have achieved quite a lot, and I would say probably about 90% of the contract is good. But the 10% that is bad is around 7-day working. You can't have a 7-day NHS on 5-day funds. It's just not possible.
7-day NHS already exists, especially for me. I do nights, weekends routinely anyway, and this new contract is not about improving 7-day services. It's about stretching a 5-day service over 7 days in a service which is already underfunded.
If you take away the financial safeguards against working people every day of the week, and you don't bring in more doctors, more nurses, more scanners, more porters, more infrastructure, then what you're just doing is taking us and spreading us thinner across 7 days. And that's dangerous for patients because you get less doctors on the ground any day of the week, and you get tired doctors who are demoralised and exhausted.
We already have a situation in our NHS where we're not adequately staffing our rotas. In many hospitals, one doctor is covering 2 jobs, as it is. And if you introduce a toxic contract into that mix, where you then stretch 5 days worth of doctors over 7 days, that can only be a perfect storm of danger for patient safety.
The main issue to me, and I think many other doctors, if not all of us, is patient safety. The reason we do this job is because we love our patients, because we care about them, and because it's an honour to be part of their time getting better, or sometimes not. This contract is going to result in doctors being more stretched, being more tired, and covering even more rota gaps.
The proposed changes to the contracts have not been modelled or planned in any way by the government. They have not prepared for the consequences of what this contract implementation will involve. We believe that those consequences could be devastating for patients.
What we need to do in this country is retain medical staff. We need to value them. They're the ones that will have the solutions. These young doctors are, they have a absolute desire, a wish to see the NHS succeed. And unfortunately, by demoralising them, devaluing them, attacking them, the very people that we absolutely need to retain in this country are being pushed away. And that has a fundamental problem for the way we deliver the NHS.
I think the government are basically trying to sink the NHS. That's a very cynical view, but actually I think a lot of people would agree with me. It doesn't seem to make any sense. If it made sense, we'd be very amenable to changes.
It doesn't make any sense. We know that. That's what we've been saying. We'll continue to say that.
What we want is for the government to come back to the negotiating table. We think that good progress was being made with the negotiations. We don't really understand the need for this sudden dramatic imposition. If they'd have carried on talking to us, we could have made really good gains.
The government claim that this isn't an assault on the underlying principle of the NHS. However, what we see is a level of incompetence that is unbelievable.
I feel absolutely infuriated with my health secretary for acting without integrity, without honesty, using statistics in the wrong way. And it goes against all the things that I have to work under, which is all these things on my sign, which is honesty, integrity, using objectivity, and with good leadership. And I would argue that Jeremy Hunt is breaking all of the GMC codes of conduct in delivering what he thinks is a safe contract.
We've reached an impasse currently with the government, and the person who can now step up is Mr. David Cameron. I think it's up to him now to step in and put a pause on imposition and put a pause on industrial action so we can actually achieve a negotiated settlement.
We're in an unsafe situation in the NHS at the moment. We're not going to stop action until we get a resolution to this, a resolution which results in a safe NHS, that we're happy that we can provide the care we want to provide to our patients.
We are sorry we're striking. We don't want to strike, and we're sorry that you are put in this position with us, but we need your support. This strike action and everything around it is about saving your lives, because if Cameron and Hunt get their 7-day, underfunded, unprepared and risk-laden service, then your lives will be the ones on the front line at risk.